all that cold weather. It's a time of year, respiratory viruses, they're on the rise. And so we're talking RSV flu, COVID, just the nasty cold it's going around. So here to talk about how you can do the best to limit the spread is Dr. Kevin Michaels, health officer for the Mobile County Health Department. Thank you for being here.
Thank you.
So yeah, we're talking about the viruses. It's that time of year. What are being most transmitted right now that you guys are seeing at the health department?
Well, what we're seeing across the community are COVID, human enterovirus, the rhinovirus.
Yeah.
So we're seeing an RSV. We're seeing the whole gamut of viruses across the community.
Yeah, and as we see those different viruses, you know, people at work, people at school, everybody's kind of passing them on. It's just par for the course. But what's the best way to kind of stop passing it as best as possible?
Well, one of the best things a person could do is get vaccinated. I mean, we have 3 great vaccines. We have the COVID-19 vaccine, we have the influenza vaccine, and for certain high-risk groups, we have the RSV or respiratory syncytial virus vaccine. So getting those vaccines is a good way to prevent it. But also, it takes about 2 weeks to develop the immunity to protect the person, so getting it now is not going to protect you for tomorrow. So what can a person do in the short term? Wash their hands, social distancing if they're sick, or staying away from people who are sick. You know, in addition to again, staying away from people, washing their hands are really the mainstay of protecting yourself. And then cough etiquette or sneeze etiquette, coughing into your armpit or your armpit. Or elbow. So
yeah, absolutely. Those are all great ideas. I feel like my hands, it being cold outside, they're so dry from washing them so much, just trying to help stop the spread.
Yeah.
What are you seeing at hospitals? Have you been hearing, you know, hospitals are full or they're closed, or what's the status with those?
I haven't gotten any input from the hospital saying that they're closed. I mean, they prepare for the flu season. But the big thing people need to remember is that not everybody needs to be running to the ER or a hospital for a respiratory-like illness. A lot of it is just managed at home, staying well hydrated, taking whatever medication to control their fever or address their symptoms. So not everybody needs to go to the ER or an urgent care or even be admitted to the hospital. It's really for the sick, you know, for people that are truly sick from that standpoint.
What would be maybe some signs to look out for that, oh yeah, you do need to go to the hospital? You
know, shortness of breath, difficulties breathing, a real high fever that can't be controlled with your typical acetaminophen or ibuprofen or one of the non-steroidal anti-inflammatories, you know, stuff like that.
Okay, good advice. And, you know, as people are maybe trying to help their immune system, is there any advice on that as far as just like being the best you can be so you can help get over these viruses quicker?
Stay well hydrated.
Okay. Yes, I've been trying to drink as much water as well, and then of course you want to eat whole foods. I try to do that myself, but it's harder, you know, all these.
A well-rounded diet will help too.
Yes, all these holiday treats have been very tempting. All right, well, is there anything else that you want to say or give to the public some advice on getting through this respiratory season?
Again, the biggest thing to protect from any viral illnesses, wash your hands, the terminal cleaning of shared items, and, you know, social distancing. We forget about it, but social distancing is really a great thing. If you're sick, stay away from others. If you know somebody's sick, stay away from them.
Good advice. All right, thank you so much for being here, Dr. Michaels. We appreciate that.